Well, to you, you're welcome to Elite Media. So today we are going inside Botswana's healthcare crisis. Botswana is currently facing a health crisis of historic proportions. Hospitals are overcrowded, pharmacies are running dry, and thousands of families are being pushed into medical debt they may never even escape. So the country's public health care system is stretched to the limit, and now the military is stepping in. This isn't just a policy failure, it is a national emergency. So on Monday, President Boko addressed the nation with a message that was both urgent and as well honest.
As such, by the powers vested in by Section 17, subsection 1 of the Constitution of this Republic, I hereby declare a state of public health emergency, granting me the necessary powers to make decisions quickly to address the immediate medical needs of the nation.
The entire national supply chain is now under military oversight. Why the military? Because the system is failing. Corruption, inefficiencies, and also mismanagement have clogged the flow of essential goods, including medical supplies. The government says, however, that this move is about restoring discipline, speed, and also transparency. So incumbent President Boko promised that the work would remain non-stop until the entire value chain of procurement has been fixed. That means everything from the medicine to equipment to basic hospital supplies will now be controlled, monitored, and even enforced by the armed forces. But this crisis didn't begin with medicine. Botswana's economy, once boosted by the diamond industry, has been struggling. The global market has actually he said, managing this shortage will be highly price sensitive due to limited covers. In quotes. In other words, there's barely enough money to keep things running, and the health crisis is only deepening. Right now, more and more patients are being turned away from public hospitals and forced to seek treatment in private facilities they can't afford. The results? Over £55 million in unpaid medical debts. That's not just a number. That's tens of thousands of people choosing between health and survival. To respond, the government has approved a £13.8 million emergency fund.
Initial sum of 100 million. The purpose of the fund is to facilitate strategic procurement of healthcare supplies to adequately support the public health system's needs.
The global market has actually cooled. International aid has been slashed. And to make matters even worse, severe drought have devastated agriculture, driving up food prices and also deepening household poverty. With the economy squeezed, the public health system became one of the first casualties. But even in the middle of this breakdown, there are signs of hope. Communities are rallying. Healthcare workers are pushing themselves to save lives. Volunteers, of course, are stepping in where the states can't. So this is more than healthcare emergency. It is a test of Botswana's resilience, a test of leadership, and also a wake-up call for the rest of the world. Because what's happening in Botswana today could happen anywhere tomorrow. So stay tuned as we continue to uncover the story to break down what's really happening and beneath the headlines. If you found this interesting, please hit the notification bell to get aware or to get notified of our updated stories. Thank you for watching.